Have you ever heard of the C-Peptide test? It turns out that your C-Peptide is an important indicator of your diabetes health and one of the most important of all diabetes biomarkers. In this video, we'll cover the basics of C-Peptide biology, explain what it tells you about your body's ability to secrete insulin, how it helps you understand what type of diabetes you are living with, as well as where and how to get your C-Peptide tested easily.
What exactly is C-Peptide? When the beta cells in your pancreas secrete insulin, they secrete it as a molecule known as proinsulin. Now, proinsulin is an immature version of insulin that's comprised of an alpha chain, a beta chain, and a C-peptide connector. Now, when C-peptide is removed from the proinsulin molecule, proinsulin turns into insulin. And insulin has very specific and powerful biological activities in your blood, in tissues. Now, insulin and C-peptide are made in equal amounts, and C-peptide remains in your blood for substantially longer periods of time than does insulin. What this means is actually quite simple. C-peptide and insulin are present in pancreatic beta cells and in your blood in equal amounts. However, C-peptide has a substantially longer half-life than insulin, which is about 20 to 30 minutes versus 3 to 5 minutes for insulin. So this means that C-peptide remains in your blood for approximately 5 times as long as insulin and is therefore present in your blood at approximately 5 times the concentration. And because insulin is degraded quickly, measuring your C-peptide value is easier because it sticks around for a longer period of time and is used as a surrogate for the amount of insulin that your pancreas actually produced.
Why is your C-Peptide important? Because C-Peptide is directly related to your insulin production, understanding whether beta cells are capable of secreting sufficient amounts of insulin to meet your body's metabolic needs is an absolutely crucial piece of information. In fact, understanding your C-Peptide value is so important that researchers believe it to be the most suitable measurement for assessing endogenous insulin secretion. Therefore, knowing your C-Peptide level is crucial in understanding what type of diabetes you have. Since the treatment of type 1, type 1.5, prediabetes, type 2, and gestational diabetes each require different treatment plans, being misdiagnosed with the incorrect type of diabetes can lead to an improper course of treatment, years of frustration, and rapidly declining health. An accurate C-Peptide measurement will provide you and your doctor with a quantitative assessment of the ability of your pancreatic beta cells to secrete insulin.
Question number 1. What type of diabetes are you actually living with? Every year, millions of people are misdiagnosed with type 2 diabetes rather than type 1 diabetes or type 1.5 diabetes because they fail to measure their C-peptide value at an early stage after diagnosis. The C-peptide test will tell you what type of diabetes you are actually living with and will help you differentiate between an autoimmune version of diabetes with extremely low insulin production or a lifestyle-related diabetes with medium to high insulin production. Now, recent guidelines dictate that a C-peptide test should be used when there is doubt about what type of diabetes a patient is living with. In addition, a recent systematic review suggested that C-peptide be used as the principal baseline measure of insulin deficiency. Knowing your C-peptide value can determine your entire course of your diabetes treatment and allow you to differentiate between an insulin sufficient state and an insulin deficient state. Although it is possible to make an educated guess about what type of diabetes you are living with, a C-peptide test gives you and your doctor much more accurate information into your overall diabetes health. Are you living with autoimmune diabetes? Now, if you are living with an autoimmune version of diabetes, either type 1 or type 1.5 diabetes, then your C-peptide value will most likely be significantly lower than if you are living with prediabetes or type 2 diabetes. But what exactly is type 1.5 diabetes? So type 1.5 diabetes is increasing in prevalence around the world and is often referred to as latent autoimmune diabetes in adults, or LADA. Once considered a rare condition, type 1.5 diabetes has been on the rise since the 1950s. Now, living with type 1.5 diabetes, which is an adult onset, slow progressing version of type 1 diabetes, means that your pancreas is still capable of producing insulin, but the presence of one or more autoantibodies against beta cells leads to a slow and progressive decline of beta cells over the course of time. Now, LADA has characteristics of both type 1 diabetes and type 2 diabetes and is often misdiagnosed as other forms of diabetes, resulting in the wrong treatment protocol. It is currently unknown how many people are living with type 1 diabetes around the world and how many people have been misdiagnosed with other forms of diabetes. But some estimates could be as many as 1 out of every 10 patients living with diabetes. And some researchers believe that type 1.5 diabetes is the most prevalent form of all autoimmune diabetes in general, therefore more prevalent than type 1 diabetes. The Immunology of Diabetes Society has established 3 main criteria for establishing a diagnosis of LADA, including, number 1, being greater than 30 years old at the time of diagnosis. Number 2, testing positive for at least 1 islet cell autoantibody. And number 3, having no insulin requirement for at least 6 months after diagnosis. In contrast, those living with type 1 diabetes experience a severe and rapid loss of insulin secretion, characterized by multiple autoantibodies and a dangerously low C-peptide value. An overwhelming majority of those living with type 1.5 diabetes test positive for only 1 autoantibody, resulting in a slow progressing loss of insulin secretion over time. Those living with type 1 diabetes often require exogenous insulin almost immediately after diagnosis, whereas those with type 1.5 diabetes may not require insulin therapy for 6 months to 5 years after diagnosis. It turns out that people with LADA are often misdiagnosed with type 2 diabetes for 3 main reasons. Number 1, diabetes onset occurs during adulthood. Number 2, beta cell destruction and symptoms of the disease occur over the course of time. And number 3, patients and doctors may have an incomplete understanding of their autoimmune status and are lacking a diabetes autoantibody panel to test for the autoantibodies known as GAD, G-A-D-D, IAA, IA2A, ICA, and ZNT8A. Now, these are all just acronyms for specific autoantibodies that are present in autoimmune diabetes. Type 1.5 diabetes is also likely in patients diagnosed with type 2 diabetes as an adult who are lean and do not have any symptoms of the metabolic syndrome, especially if that patient follows a low-fat, plant-based whole food diet and is physically active. Because a low-fat, plant-based whole food diet is so effective at preventing and reversing type 2 diabetes, if you are unable to control your blood glucose after approximately 3 months, then we recommend testing your C-peptide and getting a diabetes antibody panel immediately. We recommend getting your C-peptide tested first. Once you have that information, you can then decide if it's worth the time and effort to test for diabetes antibodies.
Question number 3. How much damage have your beta cells accumulated over time? Knowing how much damage has been done to your beta cells over time is an important determinant of whether your body requires exogenous insulin or not. If your beta cells are still functioning properly, a low-fat, plant-based, whole food diet combined with frequent exercise and adequate sleep can help you achieve non-diabetic blood glucose without the need for medications or insulin injections. If your C-peptide test reveals significant destruction of your pancreatic beta cells, it is unlikely that you will be able to achieve non-diabetic blood glucose values without the use of exogenous insulin, regardless of how strict you are with your diet and exercise regimen. If you have been diagnosed with type 2 diabetes on the assumption that you are insulin resistant, even though your C-peptide value was never tested, then taking a C-peptide test can help you avoid unnecessary oral diabetes medications and years of unnecessary side effects. Question number 4. What are your chances of reversing prediabetes or type 2 diabetes without the need for diabetes medications? Using conventional treatment, type 2 diabetes is a progressive disease in which approximately 50% of individuals require insulin therapy within 10 years of diagnosis. This results from insulin resistance, the deterioration of beta cell function, and reduced insulin secretion over time. Using a low-fat, plant-based, whole food diet combined with adequate physical exercise, you can reverse prediabetes and type 2 diabetes in 99% of cases when there is still sufficient insulin production. In this case, your body is producing plenty of insulin, but your lifestyle has created a state of insulin resistance. By optimizing your diet and movement patterns, you can reverse insulin resistance and control your blood glucose without diabetes medications. A high C-peptide value indicates that your beta cells are capable of manufacturing sufficient insulin, and by switching to a low-fat, plant-based, whole food diet, it's possible to completely reverse insulin resistance and eliminate your need for diabetes medications using your food as medicine. A medium C-peptide value indicates that you have adequate insulin production to fully reverse prediabetes or type 2 diabetes, but that it's imperative to maximize your insulin sensitivity in order to prevent your beta cells from becoming exhausted over time. A low C-peptide test means that your beta cells have been permanently impaired. In this situation, you will likely require exogenous insulin to control your blood glucose. If you are living with type 2 diabetes and have been told to inject insulin, unaware of your C-peptide value, then you are in the same situation as millions of people around the world. The vast majority of these patients have a medium or high C-peptide value and can fully reverse insulin resistance using lifestyle medicine. However, while it's true that type 2 diabetes can often be fully reversed, this is not always the case. In the progression towards type 2 diabetes, beta cells in your pancreas can begin hyper-secreting insulin as early as 20 years before diabetes is even detected. This is done in an effort to prevent your blood glucose from elevating as a result of increasing insulin resistance. Insulin is not the limiting factor in the early stages of the disease process. As insulin resistance progresses, beta cells increase insulin production, sometimes by as much as 500% of normal, in order to protect against elevated blood glucose. Over time, if insulin resistance continues to develop due to high-fat feeding, the beta cells in your pancreas become overworked, resulting in beta cell death. When this happens, you develop a state of impaired insulin production, resulting in high blood glucose in the fasting and post-meal states. Your C-peptide values follow the same progression as insulin. When you're producing excess insulin, your C-peptide value increases accordingly. And when beta cells permanently lose their ability to produce sufficient insulin, your C-peptide value falls significantly. As long as you are not living with an autoimmune form of diabetes, there is strong scientific evidence showing that lifestyle change can help restore beta cell function. However, optimal function may never be completely restored. By testing your C-peptide level, you and your doctor can find out how much your beta cells are capable of secreting insulin or if they have been permanently impaired.
Question number 5. What is the difference between a fasting and stimulated C-peptide test? There are two types of C-peptide tests. The first is a fasting C-peptide test, which is performed after an overnight fast of at least 8 hours. The second is a stimulated C-peptide test, which is used to measure the amount of insulin that your pancreas is capable of manufacturing in response to a high carbohydrate meal. Now, the purpose of the stimulated C-peptide test is to measure how much insulin your pancreas produced in the few hours after a carbohydrate challenge. The amount of C-peptide in your blood reveals how effective your pancreas is at secreting insulin and C-peptide in response to a rising blood glucose. Reference ranges for the stimulated C-peptide test are very simple. Less than 2 nanograms per milliliter means that a severe damage to the pancreas has occurred with about a 5% chance of controlling blood glucose through lifestyle measures alone. Insulin injections in this situation are likely required. If your stimulated C-peptide test is between 2 and 4 nanograms per milliliter, then that indicates that some damage to your pancreas has occurred with about a 50% chance of controlling blood glucose without the use of insulin. If your fasting C-peptide value is greater than 4 nanograms per milliliter, this indicates that the pancreas is still functioning well with about a 95% chance of controlling your blood glucose through lifestyle measures alone. Here at Mastering Diabetes, we believe that your doctor can be your greatest ally in restoring your health. For this reason, we educate our clients on how they can partner with their doctor to maximize their metabolic health. Despite the advancements that have been made in understanding and treating diabetes over the past century, lifestyle change education for physicians is often lacking in medical school. Because of this, physicians are unaware of the power of lifestyle change and are rarely educated about the importance of a C-peptide test for their patients. In addition, much of the medical school education, as well as postgraduate continuing education, is funded by pharmaceutical companies. Now, these companies have a vested interest in ensuring that type 2 diabetes patients remain unaware that their condition is preventable and reversible with a low-fat, plant-based, whole food diet. Always remember one thing: physicians are not to blame for a lack of education about lifestyle change. Until the medical system begins to place a larger emphasis on evidence-based approaches to reversing diabetes, physicians will continue to remain in the dark.
It's very easy to get your C-peptide level tested. It's an inexpensive blood test that you can request from your doctor, or you can order the test for yourself online and schedule to have your blood drawn at a local LabCorp or Quest Diagnostics walk-in facility. You can usually schedule your blood draw for the same day you place your order, and there is little to no wait time. Most facilities are open on weekends, so paying out of pocket is often more convenient than waiting to see your primary care physician or endocrinologist. If you're going to use the latter method, we suggest ordering from one of the following online laboratories. Option number 1, request a test. Option number 2, direct labs. Option number 3, personal labs. Simply select where you would like to get your blood drawn, enter your credit card information, and then take the order form to your local facility. The results are quick and often ready in 1 to 3 days.
Now, we recommend using the following guidelines to interpret your C-peptide test results. As you can see, your C-peptide results are best interpreted in conjunction with an Islet antibody test. Interpreting the results of both tests together provides you and your doctor with the most accurate information. If your fasting C-peptide is less than 1 nanogram per milliliter, that means that your endogenous insulin production is very low, which means that you fall into one of the following 3 categories. Number 1, if you test negative for Islet antibodies, then you are likely living with insulin-dependent type 2 diabetes with a low insulin production. You are likely to require both basal and bolus insulin in order to control your blood glucose. If you test positive for 1 Islet antibody and are over the age of 30, then you're likely living with type 1.5 diabetes and may require both basal and bolus insulin to control your blood glucose. If you test positive for multiple Islet antibodies, irrespective of how old you are, then you're likely living with type 1 diabetes and may require both basal and bolus insulin to control your blood glucose. If your fasting C-peptide is between 1 and 2 nanograms per milliliter, then that means that your endogenous insulin production is medium, which means that you fall into one of the following 3 categories. Number 1, if you test negative for Islet antibodies, then you are likely living with type 2 diabetes with an impaired insulin production. Adopting a low-fat, plant-based whole food diet to maximize your insulin sensitivity is your best chance at remaining free of exogenous insulin over the course of time. If you test positive for 1 Islet antibody and are over the age of 30, then you're likely living with type 1.5 diabetes and may experience a decline in your insulin production with an increased need for exogenous basal and bolus insulin over time. If you test positive for multiple Islet antibodies, irrespective of how old you are, then you're likely living with type 1 diabetes and are currently in the honeymoon phase in which your endogenous insulin production is on the decline. You will likely experience an increased need for exogenous, basal, and bolus insulin over time. If your fasting C-peptide is 2 nanograms per milliliter or above, then your endogenous insulin production is medium to high, which means that you fall into one of the following 3 categories. Number 1, if you test negative for islet antibodies, then you're likely living with type 2 diabetes with a high insulin production. You're likely to remain free of exogenous insulin as long as you continually improve your insulin sensitivity. If you test positive for one islet antibody and are over the age of 30, then you're likely living with type 1.5 diabetes and may experience a decline in your insulin production with an increased need for exogenous basal and bolus insulin over time, even though your endogenous insulin production is sufficient at this point in time. And if you test positive for multiple antibodies, irrespective of how old you are, then you are likely living with type 1 diabetes and are currently in the honeymoon phase in which your endogenous insulin production is declining quickly, even though your endogenous insulin production is sufficient at this point in time. You're likely going to experience an increased need for exogenous basal and bolus insulin over the course of time. So there you have it, everything you ever wanted to know about your C-peptide value. If you enjoyed this video, click on the thumbs up button, subscribe to the channel, and leave a comment below and tell us if you've ever been confused about your C-peptide value. We'll do our best to help in any way that we can.